Welcome back to New Day Cleveland. Knowing a little can go a long way, especially when it comes to your health. Dr. Tejas Samaru is from Southwest General Health Center. And doctor, this is some pretty exciting news. Just recently, Ohio came out with a new law that's going to be extremely helpful to women.
Right. Yeah, so now we are reporting breast density for women. So women are becoming aware of the actual fact that they may have dense breasts, which can lead to some additional factors that make us want to screen a little bit more in those kind of women. So we are now notifying women of their breast density.
Okay. When it comes to screenings, are there all different kinds of screenings out there? What all is out there for women to look into and make sure they're actually doing?
So the most important thing when it comes to screening is really being aware of yourself, being aware of your own breast health, being aware of your family history, especially knowing about your first-degree relatives, meaning your mother, your sister, if there is any history of breast cancer. There are some patients who have a risk for a breast cancer gene mutation, which puts them at a very high risk for cancer. So just knowing your own breast health and your family's health is very important. And then certainly taking the next step, which is getting your annual screening mammogram. That's very important for women, especially at the age of 40. Younger than 40, then we consider your other risk factors as to whether we need to screen these patients earlier or not.
I want to go back to this new law. What does it necessarily mean for a woman to have a dense breast? I feel like that's something maybe we don't really know what that means.
Right. So breast tissue is composed of fatty tissue, which is the non-dense breast tissue, and fibroglandular tissue, which is the denser breast tissue. And the composition of your breast can be there is no certain risk factor for that, but the fattier breast tissue tends to be easier to read on a mammogram. The denser breast tissue can hide some of the cancers because the cancers can look similar to the dense breast tissue. So that's why it's important for women to know that, because if they need to take extra steps for additional screening, that would be the case.
As a woman, is there anything you can do to reduce your risks?
Reducing your risk, I mean, again, the most important thing is early screening, early detection. So getting your annual mammogram, meaning going every year. We do see some women who had a mammogram in 2005 and then don't present again until 10 years later. And that's a long period of time to let go by. So you want to really be on top of things, annual mammograms, annual routine regular self-breast exams, physical exams with your doctor, and just being in conversation with your doctor.
Are there different mammography options for you to be involved with?
So right now at Southwest General Hospital, we are doing digital mammography, and most breast centers are doing digital mammography, which is a very, very excellent screening tool now. We're able to manipulate the images better and really get a good look at the breast tissue. We also have a new form of screening called tomosynthesis, digital breast tomosynthesis, which some people may know as the 3D exam. And it essentially gives us a 3D picture of the breast. So it gives us more information than we had in the past. So those are the two major screening options that we would begin with. If needed, we do have additional types of imaging, such as breast ultrasound, breast MRI. To use those screening tools, or to use those tools as a diagnostic purpose, really depends on what we see first on the screening mammogram. But we do have other tools as well.
And I'm guessing, how do we learn more information about this? How can we make sure we're wrapping our head around all of this?
So the most important thing, I think, is for a woman to talk with her doctor, with her primary care physician. We are educating our physicians at Southwest Hospital about these screening options and about the fact that we are now notifying women of their breast density. So that's the most important thing. At Southwest General, we also have our excellent nurse navigators who can provide a lot more information as well.
Well, thank you so much for being here. Always a wealth of information.
Thank you.
Appreciate you, Dr. Samaru, for being here. Okay.
Thank you.
Talking about